The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone, and welcome to the AIDS Foundation of Chicago's Virtual Advocacy Day Evening Roundtable, where we will be talking to both lawmakers and community advocates about what is happening during this COVID-19 pandemic, especially as it relates to people living with HIV and Black and Latinx communities. And then we think a little bit further ahead of the pandemic and start to discuss the ways that we can not only use this time to build momentum, but think about the ways that we can create lasting change so that we don't see the discouraging discrepancies and disparities that are affecting Black and Latinx communities going forward. So before we get too far into the conversation, my name is Aisha Nicole Davis. I am the Director of Policy at the AIDS Foundation of Chicago. I'm going to be introducing our panelists, but before we do that, I'm going to just lay a little bit of foundation around this conversation. So as we all know, we're in the midst of a pandemic. It's a space that we've never lived through in this century. And it's forcing us all to figure out new ways to not only relate to each other, but to advocate around certain issues. We're also seeing in this moment a light being shown on the disparities that already existed in our city and across our state, and also across the entire nation. And so it's given us not only the opportunity to point to further evidence of the disparities that we knew existed, but also figure out a way to uniquely address and figure out how to better resource and advocate on behalf of these communities. Recently, the United States Department of Health and Human Services released guidance in relation to how people living with HIV should be thinking about the COVID-19 pandemic. I know that a lot of folks are aware that some of the early guidance around the pandemic discussed the ways that certain populations were more vulnerable to the more severe effects of COVID-19 and might face a higher mortality rate. Among those groups were older folks and also people living with HIV. The interim guidance has been updated recently, and it reviews special consideration for people living with HIV and their healthcare providers in the U.S. regarding the COVID-19 pandemic. Information and data on COVID-19 are rapidly evolving, as we all know, and the guidance includes general information that folks should consider. It's up on their website, but I'm just going to read a little bit of it to you and highlight the fact that they state that people living with HIV who have COVID-19 have an excellent prognosis and that they should be treated and clinically managed the same as a person in the general population with COVID-19, including when making medical care triage determinations, which means that we shouldn't see states or municipalities moving over to try to treat people living with HIV differently than any other person who is coming to seek care for COVID-19. Additionally, the Office of Civil Rights under the Department of Health and Human Services released further guidance talking about the way that people living with HIV and other people with disabilities should be treated during this pandemic. The Office for Civil Rights under the Department of Health and Human Services enforces Section 1557 of the Affordable Care Act and Section 504 of the Rehabilitation Act, both of which prohibit discrimination on the basis of disability in the HHS-funded health programs or activities. These laws, like other civil rights statutes that the Office of Civil Rights enforces, remain in effect during the course of this pandemic. As such, people with disabilities should not be denied medical care on the basis of stereotypes, assessments of quality of life, or judgments about a person's relative quote-unquote worth based on the presence or absence of any disability or their age. Decisions by covered entities concerning whether an individual is a candidate for treatment should be based on an individualized assessment of the patient based on the best available objective medical evidence. So all that to say that even at the federal level, at the highest levels of law right now, we're seeing guidance come down to really remind people that this is not a time for us to rely on stereotypes or stigma or other assumptions about someone else's ability to not only fight off COVID-19, but also about what treatments they should be able to access. So with that being said, welcome again to this roundtable. Today is AFC's Virtual Advocacy Day. Usually we would be down in Springfield with advocates from across the state convening to meet with legislators and talking about issues surrounding HIV and other critical topics to our community. With this pandemic, we transitioned over to a virtual platform because we understand that it's still critical for advocates to meet with legislators and discuss how COVID-19 is impacting our communities. One of those big impacts is around the disparities in cases of the mortality rate across race. The effects and the impact on Black and Latinx people living with or vulnerable to HIV reflect the historic discrepancies and disparities that we've seen across many different areas of healthcare and healthcare access. Right now, the pandemic, like I said, is shining a light on these pre-existing conditions of being under-resourced and not and also really feeling the effects of systemic racism in these communities. And we're also realizing that there are some current temporary changes in policy that have increased access to services during the course of the pandemic. For us at AFC, and I know amongst other advocates, seeing these changes and shifts in policy kind of reveals that all of the roadblocks that we've seen in the past might not actually be roadblocks after we get through this pandemic. So for us, that means that we're reflecting on the ways that recommendations, not only for our Advocacy Day, but also from our Getting to Zero plan, can be seen and carried forward from the pandemic. We see that there are now possibilities for long-term and permanent solutions that will not only help us get to zero new infections, but also zero people living with HIV who are not in care by the year 2030. Right now, you're hearing my cat in the background. I'm sorry, she might pop in and out during the course of the webinar, so I just want to give you all that heads up right now. So talking back again about this pandemic, we've seen that the reports indicate that COVID-19 is having a disproportionate impact on Black and Latinx communities, much like HIV and other health conditions. Here in Illinois, especially in Chicago, we have seen these discrepancies play out. Excuse me. And like we said, we want to make sure that all of the temporary changes in policies that will address the issues of resources and access to healthcare are not allowed to be built back up when we're out of the medical emergency that we're in right now. So now that all the foundation has been laid, I'm going to introduce my esteemed panelists. I'm very happy to be joined by all of these people who not only have been dedicating their lives to this work, but are also in the position to continue to maintain contact with community and push forward different laws and policies that will benefit all the communities that we've been talking about tonight. So I'm going to go ahead and start with Lasaya Wade. Lasaya Wade is an open Afro-Puerto Rican indigenous trans woman, the founder of the Tennessee Trans Journey Project, and a member of the Chicago Transgender Nonconforming Collective and the Trans Liberation Collective, as well as being the director of Brave Space Alliance. That was one sentence, y'all, okay? Recently, she was honored at the Chicago LGBTQA Black History Recognition Ceremony and is the first trans woman in Illinois history to be honored in Women's History Month for the work she's doing, not limited to the community organizing that she's done. Her role in organizing ranges between and beyond as a central organizer for the Trans Liberation protests in Chicago, the largest march for trans rights in Midwestern history. Lasaya graduated in 2010 with a Bachelor of Business Administration degree in Business Management from Murfreesboro, Tennessee State University, and has 10+ years of experience in organizing and advocacy work with Black, Indigenous, trans, and gender nonconforming people around the world. Her role in organizing ranges between and beyond as a central organizer for the Trans Liberation Collective Chicago, which is, again, the largest march for trans rights in Midwestern history, and being a leader in the Midwest Ballroom International Legendary House of Prodigy. Next, we have Coleman Good. Coleman is originally from Texas, where he studied music education at Texas Tech University before moving to Illinois in 2002. Prior to joining AFC, Coleman was the Chief of Staff for Illinois State Representative Greg Harris. He brings 8 years of policy work experience and has developed a passion for helping marginalized communities, including but not limited to communities of color, LGBTQ+ communities, sex workers, and homeless youth, achieving full health equity. Coleman also brings to his work the shared experience of homelessness, living with mental illness, and recovering from substance use. He has been living with HIV since 2006 and seeks to build institutions that not only recognize Black humanity, but maximize the individual and collective liberties of Black people. One quote that drives Coleman in his community work is the idea that until all of us are free, none of us are. Next, we have House Majority Leader Greg Harris. Majority Leader Greg Harris was elected to the Illinois General Assembly in 2006 and represents the 13th District in the House of Representatives. He is the first openly gay person in Illinois to become a member of the legislative leadership and is also openly living with HIV. He is currently chairman of the Rules Committee and serves on the Appropriation Human Services Committee and Wages and Race Subcommittee. During his time in the General Assembly, Leader Harris has been a champion of mental health and substance use issues, addressing the needs of Illinois homeless and at-risk youth, comprehensive cancer services, marriage equality, LGBTQ issues, protecting people with disabilities, nursing home quality, and access to affordable health care. Again, y'all with these long sentences of great achievements. I'm so happy to have you all here. And finally, last but not least, we have State Representative Lamont Robinson Jr. Lamont Robinson Jr. was elected to the Illinois General Assembly in 2018 and represents the 5th District in the House of Representatives. Representative Robinson is a small business owner and previously served as an adjunct professor at Harold Washington College. During his time in Springfield, Representative Robinson has sponsored legislation that allows young people across Illinois to access preventative health care services like PrEP without parental consent. Representative Robinson has also sponsored legislation that would allocate $15 million for the African American HIV/AIDS Response Fund and has been a champion for increasing access to quality, affordable health care. He made history as the first out LGBTQ African American to be elected to the Illinois General Assembly. Also, I know that we advertised that we would have Representative Ramirez here. Unfortunately, she was unable to make it onto the call tonight. I'm sure that the next time we get a chance to have her on, she'll be here. But this is our panel. I'm so excited to have you all here. And now I'm going to turn it over to you all to have some opening statements. I'd ask that we keep them to 5 minutes each so that we can try to stay on task with our timing. And let's go ahead and go in the order of introduction. Let's start with Lasaya.
Oh, what was I supposed to say again? I'm sorry, you was winded.
No problem. Just take 5 minutes to do some opening statements and go over anything that you want to do.
I don't have any opening statements. I'm just ready to have a conversation around what needs to be done and what's happening. I think we also need to add, well, yeah, I do. Then we also need to add how federally now that through as hospitals and doctors are now legally able to discriminate trans people now, and how that has passed down as well, and how that actually does damage within the rural areas in Illinois of who can or cannot get hormones, or how does that also affect trans people from getting COVID-19 testing as well. So yeah, that's it.
So yeah, thank you for having me. I'm so excited to be here. I'm excited for Virtual Advocacy Day. I love when advocates can get together and chat and talk about all the important issues. You know, as someone who is recovering from COVID-19, and I'm grateful that I didn't have a lot of the health problems that a lot of people in our community are having. I'm looking forward to this conversation, looking forward to seeing how we can make sure that the next pandemic does not affect our community as harshly as it has, and we can get some support and get some action done on the issues that have been affecting our community for years. You know, these aren't new. It's not surprising that that COVID-19 has affected our community. It's sad that it's taken a pandemic to bring light some of the issues that have been affecting the Black and Latinx community for years. So I'm looking forward to just having that conversation and finding out new ways we can work together.
So I guess that makes me next. So first off, I'm just really, thrilled that you guys asked me to be here. It's good to see you. I wish I saw you in Springfield when we all gather in a big room down there and can have a lot more of a conversation than sometimes you can have on video. But I just want to reemphasize the point that Aisha and Coleman made about, yes, we need to look at what we're learning from the COVID epidemic, but we can't let ourselves be distracted from a lot of underlying problems. And in government and in legislatures, sometimes, there's a tendency to focus on the new, exciting, big media thing that's in front of you. And so much of the work that has to be done in regard to affordable housing and access to health care and the availability of specialists in communities and culturally competent education for physicians, hospital staffs, other healthcare providers. That's ongoing work, and we just got to be sure, in my mind, that we keep our eye on that ball too, while we focus on COVID for the at least the next couple months.
Good evening. Certainly happy to be on this esteemed panel. I want to take a moment and thank the AIDS Foundation really for the work that you've been doing 365 days out of the year. Also, I want to give a even larger thank you for getting funds out to folks in our community that are HIV positive. I think that was a huge plus, that we were able to assist folks with housing, and food during this time. And so I want to give you guys another hand raise and applause for that, because folks are really hurting, and for you to step up and make sure that people were receiving funding at this time was definitely needed. And I just again want to say that I'm happy to join the call and continue to fight to make sure that we bring resources to the African American and Latino communities.
Thank you. So before we dive into our discussion, I just want to let all of the attendees know that if you want to submit a question for us to ask the panelists, please do so in the chat box, and we'll be sure to address them. If we run out of time and we aren't able to address every conversation, we will be doing our best to follow up with folks to make sure that you get the responses to the questions that you put forward. So with all that said, and with all of the introductions out of the way, let's go ahead and jump into the conversation like Lasaya wants to. We know that the data and anecdotal information that we've seen so far is showing that Black and Latinx communities are hit harder by COVID-19 than their white neighbors. We also know that this isn't the first instance of Black and Latinx communities being overrepresented in negative health outcomes. How can we build trust with communities like the Black and Latinx communities that almost expect to see numbers like this and have this history of distrust, having experienced the systemic racism and under-resourcing of our communities? And anyone can go at any point.
Ooh. Can you say that question for us one more time?
Absolutely.
To answer question.
No problem. How can we build trust with communities that almost expect to see the disparities in the numbers that we're seeing during the COVID-19 pandemic?
I think people are trusting who they trusted before the pandemic. And I think we're relying on that trust to carry us out through the pandemic. And I've learned that enough, that especially as seen as one of the leaders within my population, be it Black, queer, or trans, they continue reaching out, like what's happening, what's going on. Lucky I'm on the channels of actually giving correct data and correct information and passing that along to the communities that I love and work so hard for dearly. And also they're trusting me to lead in this moment. And not only trusting me to lead, but also trusting their life in my hands. And that's a whole nother ball game that a lot of us leaders are dealing with. And that's really heavy on our ends of like how to make sure that people continue to get their food, how to make sure people continue to get money, continue opening up, the relief fund or food pantries, the stuff that we're continuously doing. I don't think, and slowly but surely people are trying to reach out for trust, but people are trusting what they knew before the pandemic to last throughout the pandemic, until we realize they're starting to realize this pandemic might be a little bit longer than what we expected, right? So yeah.
Yeah, I agree. I think it's going to take people putting their money where their mouth is. I think we've heard a lot of people in the community trust what they see. Talk is cheap. So I think it's going to just take like actually people showing up to the community and really being in the communities and making sure that people are actually receiving the funds that they said they're going to receive, and just actually putting the money where their mouth is. I think so many people have been told the money's coming, like with their stimulus check. People are literally starving, and they are trusting the agencies and the people that have helped them before, because that's what they have that connection with. So I think going forward, agencies and new communities need to learn to work together and work in different patterns and kind of break down some of the silos that we like to be in, especially, and build that trust by actually just showing up. I think just showing the community that we actually care by showing up in that community during the worst time is the way you do it. You don't show up just when things are good. You have to show up when things are really bad and show that you really care about the community.
Are we going in this order again?
Oh, either person can jump in whenever.
I think the last two comments sort of really got to the heart of it. Having long-standing trust with a community organization or a faith leader, pastor, what have you, are important methods, and that to communicate information from trusted sources. I think that, and as government, it's our job, or it should be our job, to bring in those folks from communities of all kinds and build collaborations and trust, as Coleman said, in the good times and the bad times. So there's a sense of an us, and that everyone is going to be heard, that people's needs are going to be taken into account, and services delivered in a way that's appropriate for that community. Up in my area, I'm on the other side of town from Lamont. We have 63 different languages spoken in my district, immigrants and refugees of all kinds also. And again, they go different places to be given trusted information and services than some of their neighbors. So, we have to have a very broad net and a very broad community outreach.
I would also agree. I think that particularly as an elected, the community, prior to me being elected, I had been working in the community. And so as an elected, folks are trusting that I get information out, that I'm going to be supportive, and that I'm going to bring community together. I reached out in the onset of this to my friend, and I always call her Ms. Wade. I'm going to continue to call her Ms. Wade, to ask what could I do as an elected official. And so, we have to make sure that we check in on our organizations, making sure that we get information out in our newsletter. My newsletter was weekly, and now it is down to daily. As information is coming in, we're trying to get that information out. And whether you are in my district, Greg's district, or Delia, that you have folks here that represent you. And so if we can be helpful in any way, please reach out to us, whether that be with housing assistance, unemployment assistance, you have received your stimulus check, please reach out to myself. I'm here, Greg is here, or any other elected official. And if you don't know who your elected officials are, still reach out to Greg and I, and let us figure that out and help you. That is what we're here for. We have to, at this time, figure out ways that we can get resource out to our community and be supportive and responsive.
Thank you all for that. And it's interesting, each of you touched on something that we've seen come up in a lot of the calls that we had today. So we're kind of at one of the later events in the day, and I had the chance to listen on a lot of conversations with other representatives across the state. And something that kept popping up in this conversation around resources is about tangible resources like food and housing, right? So like Lasaya said, people are literally trusting her with their lives. Like Coleman said, people are literally out here starving. So I know that we talk a lot about resources in this like very amorphous term that is very general. A lot of people really think about money when you hear the term resources, but what can be done in terms of getting these tangible needed things into communities, into the hands of people? I know that we have services, we have programs, we have SNAP, we have WIC, but we also see that a lot of community responses are actually creating what I've been thinking of as like pop-up food shelters and pop-up food pantries, the way that Brave Space Alliance has done in terms of getting food out to folks. What do you all see in terms of going forward? Because like we all have acknowledged, this pandemic isn't going to be ending anytime soon like we thought it might have, and the ripple effects that it's causing will still be felt months from now. What ways can we take steps to not just talk about resources in a very general term, but really talk about how to get food, shelter, all of these things to people directly and quickly?
I'll take that. I think calling shelters, calling food pantries, asking them what do they need. Do they need food? We know they need food. Do they need help getting food out to elderly patients, people that can't get out to their homes? I think we sometimes forget about the disabled. We forget about elderly people who are not able to actually go to a food pantry, and making sure that food is available at the pantry, but it's also available for people in the community, to make sure that, and we help volunteering. I mean, we're kind of like sitting on our hands a lot of the times, and so there's ways of getting out to our community. It's going to take a community like us coming together in the community to help each other. And I think that will help get resources to people that really need them, and get that information out. And also just by getting quality information. You know, I think a lot of times we hear a lot of hearsay, but making sure that quality, real, good information is going out to the community will also help, I think, resources get to where they need to get to.
I can't remember her name right off the bat. It was an Asian woman in Detroit, one of amazing philosopher. She was like, she pretty much said what we all said: if I can't help my neighbor, who can I help? And understanding if my neighbor goes down, I know I will go down too. And how prevalent it is right now to understand that if my neighbor gets sick and I go outside and they cough, I most likely probably will get sick too. And how the interconnections and how we are all connected in a way, people are starting to realize and understand this particular type of individualism is dead. After this, we're not going to the same world after this pandemic. So to understand that is to understand that what can you do? What can you list out that you're able to do to assist organizations or to assist the city or to assist the state in ways that you have the particular type of skills or particular type of wealth or a particular type of time. Right now, time is the essence of everything. How much time can you give to deliver? So one thing that we've done at BSA, we started to, within the first week, we knew the first thing that people are going to do is going to get hungry. And we started the pantry in the first week. And there are a lot of people out here, I can say my partner is one of them, that are pregnant and cannot go outside, right? So going outside is putting him at risk and also our unborn child at risk. So to understand that people cannot put themselves put themselves in harm's way, how will we be able to get them food? So our volunteer list went from 150 to like 1,500 and still growing daily, to actually drop off food weekly to people. So we went from our first week with our pantry, we delivered 1,000 bags. The second week we delivered another 1,000 bags. And it was like, okay, well, everyone's starting to feel the hurt right now. Now what we're doing now is teaching people how to save or also how to use particular type of items that they can't afford to make bigger meals. And I think that's one of the particular things that we've missed, like this generation missed in school, is home ec. I appreciate home ec because I know how to braid my own hair. I appreciate home ec because I know how to do these particular things that know what survival looks like, or sew in clothes where I know I can get a mask done, right? Then the following week we knew that the first thing we knew it was going to be food. The second thing is going to be layoffs. And understanding in most organizations and most jobs, and especially I can only speak into my narrative, trans people are normally the last one hired and the first one fired, or already the first one hired and the first one fired, depending on what they need them for. And especially if they're not in leadership, right? And most of the time, trans and non-binary people are not in leadership. And how that ripple effect is going to affect trans and non-binary people after this pandemic, right? So it already took us 20 years to get in a leadership position. Now, after this, everyone's fired. Will it take another 20 years, right? Them whole conversations are actually happening right now. And how do we continue to push forward and understand that without us also, we won't be liberated the way we wanted to be liberated, right? So when we started the Trans Relief Fund, we didn't know how heavy hitting this economic disparities did in Chicago until we figured out there's over 2,000 people that signed up for this Trans Relief Fund in Chicago. We don't have that much money. We're fundraising the best way we can. And we're doing as much as we possibly can to make sure that we get what we can out to people. So yeah, I think it's a heavy making sure we teach our communities that there's more out there than just advocating. There's more out there than trying to be the next activist. How can I actually help you learn how to code? Because we're learning right now, technology is going to be our life-saving moments. So how can I make sure that you get these particular jobs and get these particular skills in this particular pandemic? So when this pandemic is over, there'll be some places for you. So yeah.
You know, one of the things that I have done in my, I mentioned monthly newsletter, but now it seems like it's daily, is that I ask my constituents to volunteer to call my seniors in my district. And so again, there are many different ways that you can get involved. You know, calling seniors in my district is important to me because they're the group that's vulnerable, right? And so I want to make sure that if they need something, that they know that I'm here. But also it could just be a phone call because many of them might not have family. And so again, there are many ways that you can get involved. And I share this again, reaching out to myself or Representative Harris and asking, how can I get involved? We know the organizations in our districts, and we can plug you in, whether that be volunteering in our office and or assisting with nonprofits in our districts. And so again, if you want to get involved, there are many different ways that you can get involved. We cannot wait on the federal government, the state of the city to do anything for us. As a community, we have to take this on our own and do what we can to move things forward. And so with that said, reach out. There are many different ways that you can get involved.
And yeah, I guess I would just add to what other folks have said is, yeah, I think at some point now we're at a place where we all need to take a couple beats, you know, take a little pause and start to ask ourselves whether you're the state of Illinois, you know, a government like Lamont and I am, or a community, a statewide community organization like AFC, or, you know, somebody delivering food to 1,000 trans folks and their families, which is just amazing at a local community level. The question that's going to face us now is, for all of us, is what's next? You know, what is next for us? What should we be doing in the next couple months? I think these last 6 weeks, and you know, if you look back, it's only been 6 weeks. You know, our focus on things has been, how do we just preserve life at the very basic level? And that has been the focus. How do you build enough hospitals? How do you get enough nurses? You know, the federal government failed us on PPE and tests. You know, where do you find, you know, testing machines, or who will invent one? Who can invent new ventilators? And you know, how many, you know, people in the neighborhood can get together and sew masks for, you know, healthcare workers? That's survival. That was just fighting for our survival. Now we're getting into a mode of, this is not going to go away soon. You know, this is likely going to be with us for quite some time. And you know, how do we, as a community of advocates and a community of caring people, you know, plan for not just, you know, this intense moment of protecting life, but you know, what do we do with folks, you know, who are going to be losing their jobs or laid off, or who might need new skills, you know, whose mortgage payments or rents can't get paid, whose jobs may not open up again during this. It's a whole series of challenges, and yeah, thinking through what our plan's going to be, I think it's going to be a real important task for all of us.
Thank you all. And during your answer, Lamont, you actually brought up something that leads us right into our first question from our attendees. So we received a pretty long question, so I'm going to read through all of it. Older adults age over 60 make up a substantial portion of our population. They make up various risk groups that are essentially cumulative when you consider risk for COVID-19, as well as the risks for housing, underlying medical conditions, poverty, and for Black and Latinx people, and other health disparities we all know about. How can we assist our older people? I'm trying not to use all the other terms. How can we assist older folks now? And if COVID-19 resurfaces in the fall and winter, how can we assist them going forward?
Sure. You know, that's a great question. Many of us, particularly if you live in the city, probably pass a senior building. And I think that the simplest thing, again, is to reach out to that senior building and ask them, how could I volunteer? Is there anything that you need or your residents need that I can be helpful? And that could be dropping off food. It could be taking masks. It could be dropping off hand sanitizers. Again, we have to think out of the box, and we have to just start reaching out. And again, if reaching out is reaching out to my office or Leader Harris's office, or again, if you pass a senior building or is a senior building in your neighborhood, reach out and find out how you can get involved and what their needs are. Again, many of our seniors don't have loved ones. And so what my office has done, again, is to just reach out to seniors, find out what their needs are, and just have a conversation with them. We need to kind of go back to the basics, and we can do that, right? And so it's really simple things that we can do to kind of move the needle and help people in our communities that are less fortunate.
That's a question for everyone, right?
Yes.
I want to give just a little pushback to that last part. We're not going back to the same world, and we can't go back to the basics, because regardless of what it looks like, this Corona is here, right? Corona is going to be here. We don't know how, if it does mutate, or how it's transmittable, or how long a person holds on to the Corona once they're healed from it, right? So it goes into the point of how do we fix this broken system? How do we either fix it or change it into a new world where we know that the system is automatically has felt us so many times and continue to fail us during a pandemic. So it goes into a point of what can we do that we've seen the world do multiple times, that the U.S. refuses to do because we live on capitalism. And we also live on and thrive on individualism. So what does it look like for a world to be envisioned of free healthcare? What does it look like for the world to have automatic $1,000 a month for people? Because we're noticing now, because people are out of work, we're just Titanicing down a landscape with the way the system is already portraying itself. So it's going to be years before we even reboot again. So the question goes into, for myself, and especially for our representatives or our legislators, is how can we make sure this don't never happen again, and actually change this system the way we deem the system is now. So yeah.
And Ms. Wade, as always, as I mentioned a little earlier, a good friend, and I appreciate her pushing back. When I say going back to the basics, we've got disconnected, right? And so when we talk about our seniors, we just pass them by a lot of times. And so going back to the basics is knowing that we have to figure out a way to reach out to them. And that could be, again, by giving them a call. It could be when we get back, when we get out of this, it could be once they have programs. How do we go to senior bingo? How do we drop off items to them? How do we make sure that our seniors that are less fortunate know that people care about them? That's what I mean by going back to basics, is not, we have gotten disconnected. And so I think it's time for us to get back reconnected again. And we can do that in simple forms. And again, that is just by reaching out.
And it's going to be a little harder, though, to help seniors right now. At the beginning of this, if you remember, it seems like 2 years ago, but again, it is 6 weeks ago, everyone said that you are infectious to people and you can transmit the COVID infection when you are symptomatic and have, cough, fever, and difficulty breathing. That's when you're infectious. Now we know that not only is not true, but pretty much the opposite looks to be true now. And even more research may change this view, that the times that people are probably most infectious are when they are asymptomatic or pre-symptomatic. And you look at what's going on in nursing homes now, and I think a lot of that was based on some assumptions that folks who were walking into nursing homes as caregivers or family members or faith leader, whatever they were there for, if they weren't exhibiting symptoms, if they didn't have a temperature, then they were safe to be there. So there's this whole reality now where I think until we get some universal testing to be able to assess people on a regular basis, we're going to have to make some adjustments. You don't want to send someone into a senior building who, you know, like me, I don't have a temperature, I don't have a cough, but I don't know, you know, I've never had a test. I don't know if I've had it or have had it or what have you. So there's going to be adjustments. And some of this we're seeing, I think, Aisha, you mentioned, maybe this is what you were talking about, one of the things in your opening remarks about how the system has changed so rapidly for COVID. You know, look at healthcare now, where because there's no way we could have built enough hospital capacity for the number of people they thought would be sick or dying if we had not socially distanced and this took off. And we've now established, you know, hospital in place in your home, where doctors and nurses, you know, come to your home and care for you, or there's telehealth where they can, you know, take vital signs, where you can have somebody come in and do a blood draw. That's like a paradigm shift, because our whole healthcare community for the last number of years, decades, has been, if you need healthcare, you have to go to some part of town and go sit in a waiting room and wait. You see one doctor and then they give you a sheet and you go someplace else and you have to sit and wait and have a test or a blood draw. So being able to take healthcare actually into people's homes is a huge change. I mean, it's sort of like going back to the future, you know, in the 1950s and 40s, and everyone had like a family doctor who would come around. But that also protects people's safety. Massachusetts Medicaid started doing this a couple years ago. They looked at people with disabilities and, you know, other people who had difficulty leaving their homes, and saw all the comorbidities and all the bad outcomes that we were seeing. And instead of trying to figure out how to fit them into the regular healthcare system and make them go to hospitals or ERs, they equipped vans with all the equipment and took it out and met the people where they were and cared for them in their home. So you no longer had to worry about if somebody lives on the second floor and has mobility issues, you know, how do you arrange, get them down 2 flights of stairs and over to the hospital and into the room. Now you just bring the test to them, and it has not only been a boon to the folks who need the care, it's been a tremendous savings for the Massachusetts Medicaid system, because people were getting cared for early on in their disease stages and they weren't showing up in some critical, you know, like emergency, you know, high cost setting. So that was a long answer, and I'm sorry.
Oh no, no need to apologize. Thank you for sharing. Coleman, did you want to add anything?
No, they covered everything. No.
Okay. Leader Harris, you actually mentioned something that kind of segues well into the next question that I had, which is talking about meeting people where they are. A lot of the quick steps that we've seen that were taken during the COVID-19 pandemic is an attempt to kind of meet people where they are in a better way and also comply with these stay-at-home orders. So one thing that we've seen is that in trying to move quickly to ensure access to care and resources, we see a lot of things that have been popping up. What have your offices and organizations seen as the greatest hurdle to addressing the disparities we're seeing in the diagnoses and mortality rates of COVID-19 in Black communities when we're talking about all these quick adjustments and quick changes?
Well, since you mentioned my name, I guess I'll start first. We've done a lot of quick changes and taken a lot of quick actions, but to my mind, I mean, that's not going to undo decades and decades of disinvestment and underinvestment in communities. You know, we've got to have, and this is what I'm talking about, like what's next? You know, what plan can we develop to address, all these different issues, whether it is housing or jobs, or if you don't have a job, what income mechanisms are there? How is healthcare delivered? And focus on this, because these systems, as I said, there's questions about America and capitalism and individualism. Changing societal behavior, it takes a really long and sustained effort. That's not something you do in a week or a month or a year. So government and advocates are going to have to put together a plan and just focus on it for a long time.
I want to say yes and no to that, because they was able to get them a stimulus check out in a month. They was able to figure out how to be able to give people money within a month. So we know how to do it. Are they willing to relinquish the power that they hold? That's the whole problem. People are excited to have power. When people get power, they don't know what to do with that power. And they don't want to share that particular power. So I want to say yes and no to that, because we know what we need. Will we get it for ourselves? Because are they still wanting to sit on the gold toilet that they got in their Manhattan house in New York? And we all know who I'm talking about.
Well, then the question is, I think everyone said, okay, we've got to push this money out the door. But again, what's next? Where does the next round of money come from, and who does it go to?
I mean, universal health.
You're looking at then what we might have to do as a state. If the federal government does not help the states and our local governments and cities and towns, we're going to be in a world of trouble. Services that we've been used to, could likely disappear. And I was just reading a news article that popped up about Trump just before I hopped on this call. He's now saying that they're going to precondition aid to states and cities on the state or city abandoning their sanctuary city policies. So, what they're saying is you have to comply with my deportation orders and turn people in and turn them over who are immigrants or refugees if you want this money. So I hope that's not what they end up on. I hope that was just another one of his divisive talking points. But I think we're in for some tough struggles on this stuff.
Yeah, that's ridiculous. And and you're right, Lasaya. I think we do, the powers that be do know what to do. It is them having the strength to do it. We've known what the problems are. I think COVID-19 has definitely exposed a lot of problems with our healthcare system. Problems that we've known have been there, but people have been unwilling to listen. And I think as we come out of this, we're going to be left with choices, some very difficult choices, budgetary choices. We know that's going to be a problem, but I think it's now come down to what's more important to us, healthcare or money? Do we want to save people, or do we want to make a lot of money? And I think we've made so much money off the backs of people, especially Black and brown people. I think now we really have to take stock in what kind of society do we want to live in going forward, because there's the new normal is, we don't know what the new normal is going to be. We can't go back to the way it used to be, because the way it used to be wasn't working for everybody. And so we have to look forward and think of ways we can collaborate, but think of ways to done. Excuse my language, sorry.
And it's the truth. It's how blunt it actually really is because the answer's right there in front of your face, but we elected a 3-year-old into office, and it is continuous running of alphabet soup every time I turn on the TV we've said what we need, but now you have a daily TV show. Now you're happy because of you're able to be seen, right? So no one can hold you accountable and push you away because you're trying to hold this uplift this power and demand to continue to hold this particular power because you don't want to lose this particular power. But we also are now realizing how people are now governing themselves and living, not only living, but thriving in this moment of governing themselves, right? Because they're giving this particular type of pushback in this moment. So I just wanted to bring that in this conversation too.
Thank you.
And I think the undercurrent of this is, Ms. Wade mentioned electing a 3-year-old, putting them in office, is that we have to make sure that we get our folks out. It's very, very serious of why it's even more important to get folks out to vote, right? And getting involved at the local level, because we have to make sure that we put people in place, and we have to make sure that we push them to do the right thing. Yes, the issues are in front of us. We are not surprised that the African American community has high COVID numbers, lack of education, lack of health care, lack of quality food choices. So all of these things have been going on for years. And so the Band-Aid has been ripped off, and it is up to elected officials and our advocacy groups to put a plan together so this will not happen again. This is the time to do it. We are at a state of emergency in the African American community. And so, no, we're not surprised, but it is time now to make sure that we're pushing electeds at the top and the bottom to make sure that they correct this so it will not happen again. And that's, again, across the board. It's not only the electeds, but we have to work with organizations like the AIDS Foundation to make sure that we're putting correct legislation in place so that way that we can move resources and help folks through this. That the stimulus checks, as we mentioned, that's a temporary fix. But we have to get to the real issues that are affecting our communities.
Okay. So I'm going to jump ahead in the questions because you all have spoken about a lot of the different ways that these discrepancies have shown up and how they're pretty much just revealing longstanding issues that we all, on this call at least, knew about. But another problem that can stem from all the data that shows disproportionality and discrepancies is actually pathologizing entire communities, like the assumption that Black people are generally less healthy because we are overrepresented in statistics for negative health outcomes. We know that the social determinants of health and systemic racism are causes for poor health outcomes in Black communities, not any moral failing or physical propensity for being unhealthy. How do we prevent the effects of COVID-19 from being used to place blame on the shoulders of communities that are being devastated by this pandemic?
Can you repeat that again?
Absolutely.
Yeah. That's a lot.
How can we, I know it was a very long one. Just given what we know about the way that data is seen and used to sometimes pathologize communities, how can we prevent the effects of the COVID-19 pandemic from being used to place blame on the shoulders of the communities that are being devastated the most by this pandemic?
I mean, it's already happening.
Yeah.
It is.
It's already happening. We've seen it in across seas where African immigrants are being kicked out of their homes, and China right now being blamed for they're being blamed for bringing COVID into their spaces. We're automatically seeing Blackness is automatically a enemy against any state or any laws because Blackness has always been that, right? Dark is always bad, even though I love a little dark chocolate. But the point is, it's always been seen as a bad moment, right? And these bad people are the reason to point why our culture is being harmed in a particular way. And we never stand up to it. We never want to call it out because we all want to be kumbaya. And I had a call the other day with a couple of my good friends and also one of my mentors is when will Black people say enough is enough and actually start walking over everyone else like they walk over us? And I think we need to understand when we have as much power and abilities to say, you know what, I need to start thinking about myself right now. And when we have enough ability to actually come back to the conversation and talk about us, we will do that. But right now, it's talking about me, and we need to realize what that looks like and how that shift will change everything for us. I'm already in that mode of talking about, especially changing my political understanding around Pan-Africanism and understanding what it looks like to actually maneuver resources for Black people that we never had these particular type of resources before. So yeah, it's already happening, but also we need to understand that we need to stop including and also automatically start talking about us because they've already talked about themselves. So why do we need to include them in the conversation about ourselves? So yeah.
Yeah, I agree. We've already seen it, and it's the American way. You know, we've always blamed other people for problems. You know, Typhoid Mary, we blamed her. She was the problem. You know, they put, you know, back. I think it was. Excuse me. We blame the Japanese when disease came over from them. That's just what we do in America, and I think as Black people we have to get in front of that, like Lasaya says, and just prove that it's not our fault. We are not to blame for the health problems in our community. There are other health problems in other communities. They are not to blame. So I think it is about getting in front of the messaging, and because they're going to say what they're going to say. We see it. They're going to say Black people are overweight because we eat bad food. You know, that's what people say. So I think we can't really worry so much about what they're going to say about us, because they're going to say it. It's being said. We know it's going to be said. It's going to be said tomorrow. It's going to be said every day after that. I think we as a community have to decide how we want to be seen and how we want to be heard, and just try to get in front of that, because like I said, America likes to blame other people. We don't like to take stock of what's going on in our own backyard. That's at least, well, some people in America.
I agree with Coleman. I think that is more of a red herring, and that specifically in the African American community, we have to paint the narrative, right, of what our needs and wants are, and we have to also make sure that not only are we coming together, but we're also supporting each other as well. And you know, I think that the unfortunate piece is that through this virus, a lot of that's happening already, right? We're realizing that we have to do for ourselves as a community. As I mentioned a little bit earlier, as an elected official, again, we can't wait for the federal government. We can't wait for the state, the city to give us masks, right? So we have to figure out ways to get masks out to our own people. You know, within my fraternity, we were having a chapter meeting, and after the chapter meeting, our virtual chapter meeting, let me put that out there, that the Polmark called me and said, you know, what can we do as a fraternity? We have a foundation in Woodlawn, and I said to him, we should get our fraternity members together and raise money and get masks out to Woodlawn. Woodlawn is a community, unfortunately, that has a high number of COVID cases. And so again, we have to change that narrative, and that we can correct some of these wrongs. We can support each other once we figure out ways to come together. And so again, a lot of that is a red herring that we've been hearing for years, but we can change that narrative.
Okay, so let me answer this in just a little bit different way, just sort of building on what Coleman and Lamont had said. I think there's a lot of intentionality that's on right now that people are not realizing about how divisive this, you know, issue can be in our culture war America. And I think a lot of it is groups who have been trying to divide the country for a long time now have found a new tool or a new weapon with which to do it. And you can see it now on the news every day. You see it in social media constantly, and it started as this reopen movement. I don't know how many of you have seen it, the reopen Illinois, reopen Tennessee, reopen Virginia. It started as a couple Facebook posts, but it turns out to all have been linked back to a group. And I'm putting on a slight tinfoil hat here, but these are facts that have been reported. Funded by groups called Freedom Works and other allies of the Koch network and some of the PAC groups affiliated with the Trump campaign to start this reopen movement. And you probably saw it on TV where they'd show pictures of, look, here's 10 guys with Confederate flags and a Trump flag standing outside a state capitol. But the news reported it every night, and it has grown and it has grown. And here we're seeing in Illinois now, where the script is being flipped by these folks, and tons of people are buying into it. And the narrative is, we in the good parts of the state where this disease isn't are being penalized because of all the people who are getting sick in those communities up in Chicago and Cook County. Why are we, the good people, having to suffer and have isolation and quarantine because of them? What we should be doing, they say, is open up the state, open up our businesses, then isolate and quarantine those who are at high risk of infection to protect the rest of society, rather than telling everyone to shelter in place. And yeah, this is a really dangerous moment. Tony Preckwinkle, I think today, stopped a ordinance at the county board that would make a registry required of anyone who has tested COVID-19 positive or who has been tested, that would be reported to law enforcement and publicly available. And those, I lived through the AIDS epidemic where we saw this too, of let's just register and quarantine all those HIV positive people. It led to loss of jobs, housing, credit. You could be discriminated against, turned away from public accommodations. And I just worry that some of these right-wing forces are out there now going to use people's fear to turn this disease against a lot of civil liberties and a lot of the things that we stand for.
Let's be blunt around that. I love a blunt conversation. And the honest truth about it is, okay, these Negroes, these people of color are getting sick. White folks aren't getting as sick. So let them go out and let us continue to work. It is what the hell it is, right? And that's a continuous thing around how this culture, U.S. culture, continues to see people of color less than, and we are not worthy of being protected or being or protecting ourselves in this particular climate. So that's a heavy conversation that I've also been having with some of my colleagues as well. It's because no one is actually saying that. And most of the time it's ignorance that follows and pushes them conversation forward, because we don't care about you. I'm worried about getting a haircut. Well, what you can do is go on Amazon and buy this $5.99 wig and braid your hair and call it a day, and get on calls like the rest of us. But the understanding that you're so entitled and you feel as though that your privileges are being taken away from you to protect everyone. Again, that's a part of individualism. I myself am okay, so forget everyone else. So that is a big part of what is happening and continues to happen, because we won't change that culture and hold them accountable, because everyone has the right to speak and say what they want to say when they want to say it.
Yes.
Okay. We're getting close. We're getting close to the scheduled end of the conversation. I have one more question that I think is important for us to hit before we turn completely over to all the questions that we've gotten from our attendees. And this question is really just about the ways that people have been drawing parallels between the HIV epidemic and the COVID-19 pandemic. So as somebody who has seen the lingering discrepancies in health outcomes, when we talk about ending the HIV epidemic, meaning the way that the numbers look in Black and Latinx communities, and especially for Black trans women, what do we think we're going to see when we're thinking about the lingering effects that COVID-19 will have on people living with HIV, on Black and Latinx communities, on immigrant communities, and on these queer communities as well? What steps can we take to avoid these ongoing discrepancies in the COVID-19 pandemic that we are already seeing in the HIV epidemic? I know that everyone on this call has been part of the conversation around getting to zero here in Illinois, and we know how hard it is to try to bridge those gaps and remove those disparities that we've seen across different racial groups. how do we keep that from happening with the COVID-19 pandemic? Or let me take it back. How do we keep it from getting exacerbated beyond what it already is, and reduce the potential harm that can come from that?
Well, I'll just get started. The HIV epidemic is not gone. Has gone away. It's still just prevalent in Black and Brown communities as it ever was, if not more. So there's that. I just want to say that because a lot of people say, "Oh, this is just like the HIV epidemic." No, the HIV epidemic has never gone away. It has gone down in other areas, but it's not gone away. So I think, like the Black AIDS Institute talks about, until we work on getting the needs and concerns met of Black people, we will never be able to really end any type of epidemic. And I think my fear is that what's going to happen is the pandemic's going to die down, COVID's going to die down in certain populations, and we're going to forget about it. And we're not going to continue to fix the problems, the lack of access to healthcare. And also, we have to think about the reason why a lot of Black people are getting involved is because they're considered essential. They're considered essential workers. They, working at a fast food restaurant is essential. We drive the buses. We are in spaces that continue us to be in the public. We have to go to work. We don't have the privilege to not go to work or to work from home. So it's a cultural thing. But like I said, my fear is that as this dies out, we will forget about the real issues that caused this pandemic to really hit our community the hardest, which is like, jobs and owning a home. Owning a home is such a huge part of the American dream. I mean, knowing that you don't have to leave your house, knowing that you are safe in your home. A lot of Black people don't have that. We don't have that safety of knowing where we're going to sleep, knowing that our home is safe and secure. So I think there are a lot of things that we need to make sure that we keep to the front, at the forefront as this goes on, because I think my fear is that what's going to happen, it's going to go down in certain populations, in certain neighborhoods, and then we're going to forget about it. It's going to be like, oh, it's COVID-19 is gone, and Black people are still going to be dying.
Anyone else want to?
Thank you, Coleman. It's hard. It's hard to even give an answer to that question when I have TGNC, transgender non-conforming people, constantly hit me up talking about I need housing, right? And this was before this pandemic. It's hard to talk about how I'm going to make sure they get health care when they don't have access to jobs to pay for health care, or they don't have health care, right? It's hard to tell them that it's going to be okay when we deal with society that says that we're less than. So how can I tell them or go back to them and give them a truthful answer when the state continues to refuse the leadership of trans and non-binary people? And even coming from me as a person as educated as I am, or as many relationships that I do have continue to get denied through the state and the city around housing or around getting testing money, and being told the reason why you're not getting this money is because we don't trust Black, trans, or Latinx leadership. I do have that in a receipt from the city, CDPH, if y'all want that information. It's an importance to really continue to get that pushback. And it's an importance to continue to say that we need more than what you're giving us, and what you're giving us is actually 2% of what we can actually have. So yeah, it's hard to even answer that question when we are not getting what we had before, and we're not getting it
now. I would agree. As a legislator, coming into this role, and the governor talking about getting to zero, and knowing that we have a fund called the African American Response Act, and that fund has less than $1 million in it. The African American Response Act was an act put in place to specifically stem the rise of HIV in the African American community. And that particular fund at the state level had less than $1 million in the fund. And that prior to me getting the legislator, that no one had raised the flag or had been advocating to increase the African American Response Act. And so, you know, my plan of attack before COVID was to increase that fund because we as African Americans are dying of HIV, do have the majority of the HIV cases in the state of Illinois. But when we look at funding are not going to our organization. That is a huge problem, and it saddens me that, again, no one has raised the flag or asked the question. Also, that we don't have our own LGBTQ center on the South Side, which is why in the $45 billion capital bill, I secured $15 million to make sure that we do have our own center that will have housing, that will have health care. Now, as Ms. Wade mentioned, that our community needs something now. We need housing now. We need healthcare now. And I know the things that I mentioned, particularly around the center, are 4 or 5 years out. But because of COVID, we have an opportunity to push our electeds across the board for resources. This is the time that when we're asking for resources, that the community is standing with me and standing with Leader Harris and whoever else when we put together a plan of action for needs for our community. We need folks that will write the governor, will write the mayor. Ms. Wade mentioned that she hasn't received funding. And so we all should be asking our mayor and our city officials, why not? And so we need everyone to be able to back these pursuits because we need resources today. As I mentioned, there are things that I am working on, but that is 4 or 5 years out. We need resources today. And so, yes, that is a very, very, very hard question to ask, particularly when, as an elected official, when you do get to see some of the challenges and you wonder why our community has high rates of HIV, lack of education, then you realize that monies have not been flowing into our communities. But again, we need the community to advocate for more resources, and we also need to make sure that folks that are on the call, that we need many of you to step up and run for public office. Leader Harris and I cannot do this work alone. We need more folks that are screaming and hollering and cursing and acting a fool to make sure that the African American community gets the resources that they deserve.
But we can't also erase the work that Affinity has done. I really want to make sure, like, if it wasn't for Imani, the past ED for Affinity, I wouldn't be able to be in these spaces that I'm in. And she also allowed me to walk in these particular doors where they continue to refuse for me to walk in. Also, Black Gay Men's Caucus that have been doing the work throughout Chicago as well. These are Black-led organizations, Black-led, trans-led, lesbian-led, gay-led. But we used to call ourselves the ABCs before everywhere else got their jobs, but jobs everywhere else. But the point is that we cannot erase the work that they did, right? And the work that they continue to do on the South Side, and especially Affinity, creating spaces through via online, as well as Black Gay Men's Caucus as well. So it's important to bring them into the conversation too, and we cannot forget that we are actually working on the backs of their work that they have done over the last 20 to 30 years.
Okay, so I guess I'm the last one on this question, and yeah, I think Coleman I would second everything Coleman said in his answer. So I'm just not going to elaborate on that. But when Lamont was talking about a lot of the work he's doing, which has sort of like a midterm goal of 4 or 5 years from now, it's not immediate. One of the other jobs I have in the House is I'm the chief budget negotiator for the House Democrats, and so when we sit down with the governor and the Senate to negotiate the budget, that's one of the things I have to do. And I will tell you that as the governor announced last week, I think our revenues for the state have declined about $7 billion during this episode. So as sales taxes declined because people are not buying things. Folks who lost their jobs or their hours were cut back. The income taxes they paid have gone down. The fight over the budget, I think, this year will be about communities being sure that preserving what they have, and prioritizing things on their list of needs that are going to be most important to them. Because if the federal government does not come through with assistance to Illinois or other states, we're going to be a world of hurt financially. Just maintaining is going to be really, really difficult. And all those decisions have to be made in the next couple weeks. So, that's upon us. So, thinking about how we prioritize things. And certainly, Lamont, he just paused. I was going to say, Lamont's a great person to work with. He turned his camera back on. I wanted to hear me say that. And we're going to work, but we're going to also need, you folks to go out to all of our colleagues and emphasize that as we look at, mental health and HIV and violence prevention and child care and, affordable housing, that all these things are maintained as a priority.
Okay, and I want to reiterate that Leader Harris mentioned is that, and I want to simplify that our checkbook is going to be even more so laser thin moving forward, and our community needs resources, and so we are going to have to make sure that we're reaching out to our colleagues. You're reaching out to your state reps and your senators, as well as the governor, to let them know that we cannot cut our funding. And that's extremely important. Leader Harris just mentioned that. We need all of our organizations to make sure that, again, that you're advocating for resources for the African American community, because everyone is going to be at the table saying that their community needs X, Y, and Z. And we know that we need to be, unfortunately, at the top and at the front of the line asking for resources. And so, again, we need everyone on deck to be able to call the governor, write the governor and your elected officials, and let them know that the resources that we've been getting, they cannot be cut. And actually, we need even more resources.
Thank you. So we're actually running up to the end of our scheduled conversation. Is everyone on the panel comfortable staying on for an extra 10 or 15 minutes so that we can get to some of the questions from our attendees? Okay, cool. Perfect. So in your last answers, actually, Representative Harris and Representative Robinson, you both talked about budget and the deficit that is something, well, the projected deficit, that's something that has been coming up in a lot of conversations we've had today during Virtual Advocacy Day. So we understand the pressure on lawmakers around this conversation, and we've been speaking to our federal representatives about the funding sources from the federal level coming down to the state and local arena, especially around these COVID-19 pandemic packages. But when we're talking about things that can happen on the state and local level, have there been any conversations around revenue generating options like a fair tax or a millionaire's tax that could help cover some of the deficits that we're projecting to come as a result of this pandemic? And if those conversations have been happening, or if they haven't been happening, is it something that you would be willing to put forward? And if they have been happening already, where do you all stand on that?
Yeah, I'll start. And yeah, the fair tax idea actually was passed by the House and Senate. This is what, fair tax is just another way of saying progressive income tax. In the state of Illinois, we're one of the few states who has a flat tax. So regardless of how much money you make, what your income is, you pay the same amount as a low-income family. Progressive tax is much like the federal government. So the more you make, the higher percent you pay. So that's going to be on the election ballot this November, along with all the president and the other races that are going to be on there. So it's really important for people to get out and vote, in my opinion, and support a fair tax. When I voted for it in the House, it was because it will generate several $1 billion more in revenue for the state of Illinois for education, for healthcare, all the other things that we've talked about communities needing. And it will do it by, adjusting the taxes so that the rich pay their fair share. And in fact, 97% of the people in the state of Illinois will pay either what they're paying now or most cases less than they're paying now. So that's on the ballot. That has to go through. If it doesn't, then our problems continue. And as far as changing tax structures, I also have some other bills that I've filed that close corporate tax loopholes, that eliminate the offshoring of profits and things like that. And all those are, individual smaller solutions, but the larger solution is the fair tax.
Leader Harris, again, to your point, it is so extremely important, and I know I'm preaching to the choir, that we get our folks out to vote. We got to dump this president. He has to go, absolutely. Secondly, that the rich in the state of Illinois have to pay their fair tax. That's what the fair tax is all about. I supported it in the House as well, as Leader Harris mentioned. It is a tax that, again, is needed. That way that we can put more money into our programs, that we can make sure that we put more money into our neighborhood schools. That money, again, coming from the folks in the state of Illinois that are making above $250,000. They have not been paying their fair tax. And again, it is one of the ways, a simple way, that we can get monies into the state. As I mentioned a little earlier, our account, our bank account, is going to be very laser thin, particularly after this COVID. And so we have to make sure that we support this. This will be on the ballot come November. And so we have to get people out to, again, dump the president, and also to make sure that they are supporting and voting yes for the fair tax. The state desperately will need this revenue.
Thank you. So we have another question from our attendees that goes back to what Lasaya said earlier about people, mainly Black people, having to do our own thing and pull ourselves up and put ourselves at the front of the sentence instead of at the end of the sentence. Someone said, from the conversations that they've heard today, it seems that the city and state elected officials are moving in the opposite direction of the federal government. How do we heal this rift in values going forward? Or do we do what Lasaya said and just continue to do our own thing and prioritize ourselves?
Go ahead. I like that question. Go ahead.
Well, I can tell you, as the legislature, we've been doing a number of things for the last couple of years, which I wish we didn't have to do, because it should be done at the federal level. And when we had President Obama, these things were taken care of at the federal level, and we didn't have to worry. But now we're spending a lot of time enacting into state law and paying for out of state money things that the federal government has always done for Americans and now is abandoning. And it's not just budgetary items. It's things like protecting the right to vote, clean energy and climate, immigrant protection. Illinois has had to become like a lighthouse. It's a beacon for women's reproductive rights, as the president has fought women's health care and abortion. He's trying to eliminate the Affordable Care Act. So we've had to start passing in Illinois and paying for out of our own money health care for folks in our state that the government always used to pay for. We'll keep doing that as long as we can, but you've got to keep voting, electing people who support those values. And we've all got to work to get rid of the guy in Washington who's literally trying to tear down our country and tear up some of his people.
Okay. We have a question about the policy changes that have happened as a response to the COVID-19 pandemic. What changes have you all seen that have been made temporarily due to the pandemic that should be made permanent post-pandemic? And that's to everybody.
Wow. I'm like,
I mean, everything.
I know I'm not a panelist, but actually.
Stumped, right?
I can start off like everything. Like, I will continue to fight because for universal health care and universal income, because we're starting to learn we're starting to learn how we implode when we don't have nothing. I like when Harris said we will do what we can as a state as long as we can. But we also need to understand if we had universal health care and universal income, you wouldn't have to do this. And understanding that if we had them things, we wouldn't worry about imploding again, right? It's common sense. Italy changed all its methods and all its policies within a matter of months because they noticed how impactful Corona was, right? And now people are not only staying home, they're actually slowly but surely getting out of the Corona incident, pandemic they had over there. So we know what it looks like, but will we do it, right? So yeah.
Yeah, I think the focus on telehealth and probably putting more funding into that, especially mental health. I don't know if we've actually talked about the mental health that's going to come out of this. We're going to have to really do a lot of work, making sure that that's available to people. Mental health services, telehealth services are really, really big, making sure that people have the ability to see a doctor without leaving their home. I think that's going to really have to, that's going to be something that needs to be permanent, and making sure that insurance companies are covering that until we get to universal healthcare, which I'm all about universal healthcare too. I was in Europe last year and I'm sold.
And I think.
Any questions from the representatives?
Well, yeah, I think we'll have to go through all these different things that have been put in place and evaluate, can they keep going? Telehealth being a good one, but there you get back to what I said a little bit ago about also keeping our eye on the underlying problems that existed long before COVID. Telehealth depends on access to high-speed internet that's reliable. So if you are not a family who does not have access to a computer with a camera and a microphone and high-speed internet to deliver telehealth services, you're out of luck. And there's a lot of families in Chicago area who that's not true for. But boy, you go south of I-80 to the more southern and central parts of Illinois, their hospitals don't even have high-speed internet. Forget a lot of the people in their residential homes, and we've had to deploy these special transmitter repeater boxes to hospitals so even the doctors could communicate and send images over high speed. So just building out an internet backbone and making sure that every family has access to that is a long-standing challenge.
And I would say the answer is yes. We have to, get monies out to people in need, first and foremost. We also have to make sure that we make grants and loans available to small businesses that are struggling, which are the backbone of our communities, which hire folks in the LGBT community. And so the answer, again, is yes. We have to assess all of the things that we've been doing at COVID during this COVID pandemic. But again, getting monies out to people that are in need and supporting our small businesses are hugely important. We've already talked about how healthcare is important, having universal healthcare. So I won't go down that road as my colleagues just mentioned. But again, getting monies out and also supporting small businesses is extremely important.
Okay. And I'm actually going to use the last question to combine two questions because I want us to end on a forward-looking, positive thinking note. So we had a couple people ask about different things that either made you excited or hopeful. So in my own way, I'm just going to go ahead and blur these two questions. What personal lessons or anecdotal stories have you seen or heard of during the past 7 weeks during the pandemic that either make you excited about what is going to happen in the future or what can come of this moment, or has kind of taught you a lesson that you want to take into what becomes the new normal?
More self-care
for everybody.
More self-care. I've been connecting with people I haven't normally speak with like 3 to 6 months. We be on house party all night, kikiing, talking about everybody and everyone up under the sun. I've been able to drink more wine than I normally able to do. I think it's right now I have to be able to realize the small things I enjoy are keeping me sane right now. I'm a big gamer, so I've been playing games. I've been, using my Switch. So, and also just connecting with old people that I care for and love dearly. And I think Robinson, I think it was very important, that part of like keeping access to our elders, calling my grandmother more, calling the elders that have taught me and got me to where I need to be today, and asking what they need, not telling them what they need, and understanding they still have autonomy over themselves. Even though my grandmother's like my baby, I love that woman. But it's enjoying the small things of life right now. So I miss outside, but outside will wait until I know there is at least a clinical trial of a vaccine, because I don't trust nobody and no one right now. So I appreciate that mental health part, because I'm going to need a therapist, because I don't want to touch or talk to anybody within 6 feet right now. So yeah.
Yeah, I'll go. I think being that when I was earlier this month dealing with a lot of the symptoms of COVID-19 and not being able, I think I took for granted like breathing, just being able to breathe like a normal person. Like going up and down the stairs became very difficult for me. So I think I've learned to just really appreciate being able, like, the health I do have, the good health that I do have. Gaming, oh my God, my PS4 has not seen so much attention. But it's also helped me connect with other people, because I've been playing like online with other people. So it's just, I don't know. I'm also looking forward to the collaboration. I really enjoyed the collaboration I've seen within our community, other organizations working together. So I'm hoping that continues after this. There's been some great work. Black Damon's Caucus, they've been mentioned. They're doing some great stuff, getting information out. And I think I'm loving seeing that community coming together and organizations working together has been really beautiful. And so I'm hoping that continues. I think it will, because I think I think I've realized how much I miss people. Like it's been a while since I like hugged somebody, and you miss those small little things. Like, I mean, I go and see my woman at the Walgreens, but that's not the same. We talk about hair glue and it's great, but I think just community is really, really important. I just moved to the South Side. I want to get out and enjoy it. You know, I can't go anywhere. You know, I want to go eat. I want some jerk chicken. And so, yeah, I'm looking forward to exploring the community. I think it's not taking for granted the little things that I think I take for granted every day before this. So, yeah.
Coleman, I will agree with you. And one thing that you said that really, and maybe because it's the late hour, that I want some jerk chicken as well. And I'm mad that I live on the South Side. I'm in Bronzeville, and my jerk chicken place is closed down. So thank you for that reminder, Coleman. But for me, it has been just having a moment to reconnect with old friends, reading, walking in my neighborhood, catching up on TV. It's hard, you know. Leader Harris and I spend 6 months out of the year in Springfield, and then when we get home, we're never home. And so just having to be in my home, catching up on Netflix, finally being able to finish Ozark. You know, they're just simple things that I'm just happy that I've been able to really zoom in on. But you know, I'm an only child. My mother and I are very close. Not being able to hug my mother. I mean, those are things that you know, you forget how the simple things in life, when they are paused, is extremely tough. I am hopeful that that we continue to build community. It has been so warming to my spirit when I get several emails for folks that want to volunteer. They want to call seniors. They want to donate masks. They want to donate hand sanitizers. They want to get meals out to organizations in my community. In my community. And so I hope that continues. I hope that we continue to build community and continue to support each other. And so that is what I am hopeful about.
So everyone else had all the good things. I will just point out to Coleman and Lamont that a block down from me on Wilson Avenue, there is a jerk chicken place which is open. So you can text me afterwards, and there could be a jerk chicken run in your future, you know, socially distant one potentially.
Yes. The one by the 7-Eleven? The one by the 7-Eleven?
Yep.
Okay. Thank you, Leader Harris.
I live very close to Coleman, so if we're doing a South Side run, just let me know.
But I think Lamont summed it up is, you know, for all of us, you know, this has forced us all to slow down our lives in a lot of ways, which we just didn't before, and a chance to appreciate just small things like the friends we have, who we sometimes we're in such a rush to do the things we're supposed to be doing. At least I find that I put aside, you know, for friendships, and it's like that can wait because I've got this other task or activity, and yeah, now I don't have that anymore, and it's been really nice. Like I said, missing physical touch and physical contact, or being able to have, yeah, a bunch of people come over for dinner and everyone not freaking out, wondering, you know, who's got viruses and who doesn't, and, you know, all those kind of things. Yeah.
I know, I like everyone's plans for the new normal. I'm here for it. I hope that all of that comes to fruition. And I would like to thank you all for staying on this extra time, having such a wonderful, dynamic conversation. I really appreciate it. I want to thank all of the attendees who have stuck with us. I can see that most of y'all did. I appreciate it. And thank you for your wonderful questions. Right now, this is the end of this webinar, but it's not the end of the outreach that we're doing. Feel free to stay in touch with the AIDS Foundation of Chicago. We're available on Facebook, Instagram, and through our Phone to Action. I don't know if it's like a program. I don't know how to do it. Our communications team is going to be so upset. But Phone to Action is another way for you to stay in touch with AFC going forward. We do have all of the other questions that were submitted throughout the course of the conversation. We will be trying our best to get our answers to those, follow up with you, and be in touch. Right now, we're going to let our panelists go, enjoy the rest of their evenings, whether you have some jerk chicken or not. And we thank you again for all of your continued efforts and work in the community and for the community. Everyone have a good night, and thanks for participating in our virtual advocacy day.
Thank you.
Thank you. Good night, everyone.
Bye.